So today I'm going to talk about weight loss. Why? I've talked about weight loss before, but it's so important to understand that there are so many different factors interfering with your body's ability to lose weight that it becomes very frustrating. And many of you probably feel like you're in a box and just cannot get out. So I thought it would be great to focus a little bit more time on weight loss and how we're able to achieve effective weight loss in our office when you come to see me. So, again, obesity, weight loss, lack of being able to lose the weight, losing the weight and then piling it back on within, a few weeks, it's back. And the frustration around why counting carbs and calories and portion control and all of that is just not helping you. Does that sound like you? Well, if it sounds like you should listen in because there are multiple hormonal imbalances. And when I say the word hormone, I am not talking about estrogen and testosterone necessarily. Of course, that may have some effect, some impact, but overall, the majority of the reason most of you cannot lose weight or keep the weight off is because you've got multiple other types of hormonal imbalances working against you at the same time. And that's why it's so difficult to figure out a method or a way to effectively not just lose the weight, but keep the weight off, right? I mean, that's what it's all about. You spend all that time working on losing the weight, you want to be able to keep it off. And the traditional method of counting carbs and calories and portion control and pushing away from the table and looking at the food pyramid and saying, okay, I've had this much vegetable and this much bread and this much, and you're like, I'm doing everything and you're exercising. You're working out in the gym, and that working out just is not working out for you. It's not working out too well, is it? And so that workout regimen that your exercise coach or whomever has put together for you, it is a great regimen, I'm sure. But many times, many of you will find that it is not helping you sustain the weight loss. And that's what I'm talking about today, sustainable weight loss and why you are having such a difficult time losing weight. So let's bring up my little slides. I'm going to shrink into one little side, tiny little picture of me, and there's going to be slides of multiple different types of hormonal imbalances. So if I could have, there we go. Thank you. So those multiple types of hormone, these are just four, actually five things that are very, very much involved in your inability to lose weight. And they also are involved, very much responsible for not just not being able to lose the weight, but other symptoms that you may be having with obesity or with your problems or your struggles in losing weight. So does fatigue or brain fog or sleep issues or um, the ability to um, eat foods without having digestive problems, does that sound like something you're dealing with too? How about these unexplained rashes that you get, or even sadness, depression, anxiety, low libido? How about those things? Does that sound familiar? Yes, many of you, not only are you dealing with the trouble or problems losing weight, but you're also dealing with those other signs too, those other problems, those other issues. And guess what? They're all related to you not being able to keep that weight off. Isn't that something? So when you look at the inability to lose weight, you must understand that the problem is that there are multiple imbalances all working against you at the same time, making it very difficult for your body to regulate its weight loss, and that the inability to lose weight is actually a sign and a symptom of other problems. So when you go to try to get a some sort of diet or something you see on TV that has these wonderful before and after pictures and people are testing how happy they are and They're like 40 pounds less, 100 pounds less. What you don't realize is that they are probably going to have to take something, some kind of product for the rest of their life to keep that off, to keep that weight off. And that probably is not what you want to do. I'm not denigrating or saying that those other programs don't have some effectiveness, because they absolutely do. But it's all about getting your body healthier. And once you do that, many, many times, the ability to lose weight is a natural phenomenon. I'm going to say that again. Once you address the underlying issues, the hormonal imbalances, again, I'm not referring to the sex hormones here necessarily, but I am referring to the fact that there are other hormones in your body that may be all dysfunctional, not working as well as they should. You don't have enough of it, or you have too much of it. Whatever it is, they can work against you at the same time and make it very, very difficult for your body to regulate weight, lose adipose tissue or fatty tissue, and keep it off. So the inability to lose the weight is a sign and symptom of other hormonal imbalances in your body working against you at the same time. It's not necessarily, and the weight gain is a sign of the fact that those other hormones are imbalanced. The weight gain is a sign that the other hormones are not balanced. So when we work with once we identify what those are and work with you from that perspective, then the weight comes off naturally. It absolutely comes off naturally, because your body is becoming healthier. There's some healing that's occurring from the inside. Your body is made to heal itself as long as you give it what it needs. Now, does that mean you never have to take a prescription pill? Absolutely not. I'm not anti-prescription at all. I think there's some wonderful meds out there. However, whenever we can allow the body to work as naturally as it can and to balance itself as naturally as it can, I think we need to give it that opportunity. And the problem is, many, many times, so many of you are very well read, you've researched, you've studied, you've looked into your problems, some of you come to me and you know what's going on. You just don't know what to do to address it and to make it better. And that's where I come in, because I understand that obesity, or the inability to lose weight, or gaining weight and you can't figure out why, despite all your best efforts, is a symptom of other problems. And when you focus on those other problems, the symptom goes away or it gets better, right? So let's talk about what some of those hormonal imbalances are. So on the screen, I have some of the more common ones. And we start with estrogen. Why? Because so many of you ladies come to me thinking that it's menopause that's causing you to have trouble losing weight. So many of you come to me saying, well, I have hormonal problems. I do discovery calls on certain days of the week where I'm actually physically calling you to talk about why you are concerned about your health, what's really going on. And many times, one of the first things people tell me, oh, my hormones are off. And they mean the female hormone. They're talking about estrogen because they think everything is menopause. Not your fault. As a traditional physician myself, I've been a doctor, board certified in family medicine for 27 years. So as a traditional physician as well, I know how we have blamed so much on menopause. Everything's menopause. Everything's menopause. You can't lose weight. Menopause. Brain fog. You're menopause. Everything is blamed on menopause. When I'm here to tell you, it's not true. Sometimes it is. Don't get me wrong. Yes, there are some menopausal changes, no doubt about it. But it's not always responsible for every ache and pain and issue and concern that you have. Don't walk out of the doctor's office letting them make you believe that every concern you have is menopause because all of your blood tests turned out normally. All of the tests they ordered on you were normal. Everything's good. Even your thyroid, right? And so your problems are in your head, or it's just menopause. I can't lose weight. It's just menopause. Everything. I have brain fog. I have fatigue. I can't sleep. It's just menopause, right? So it's not just menopause. There's so many other things that are going on with you. And that's what we do. We identify what those are to help you lose the weight. Otherwise, you'll never lose it. You'll live exactly the way you are. And how good is that, right? Especially when the obesity causes other problems. So the first thing on here is estrogen. Estrogen actually allows your body. The reason women have so much more estrogen than men is because, first off, it's responsible for our sexual characteristics as a woman, right? Secondly, one of the main areas that estrogen is responsible for is regulating our menstrual cycle, but it also helps us maintain or keep more body fat. It's very important because estrogen is also produced in our body fat, and we need it. We need it to regulate our menstrual cycle. We need estrogen, but we don't need too much of it, right? And at certain points, the estrogen levels drop, and that's a natural thing. However, estrogen imbalance tends to have the first body shape that we're looking at here. And ladies and gentlemen, I want you to see these pictures. And are you looking in the mirror when you see these pictures? Is it you? Is this what you look like? Right? Is this familiar? Were you born like this? No, no. When most of you, when you were a young child, you didn't have these body shapes. You didn't look like that. That tells you that something changed along the way. And that this first picture that shows large hips, probably a buttocks and a pooch in the front, is more characteristic of bottom half weight of being an estrogen imbalance. We'll talk about more about that in the next segment. So we are talking about the hormonal imbalances responsible for you not being able to lose weight. And the first one on here is estrogen. And with estrogen, it's so important for me to point out that many times when our body is changing, many times when we go through menopause, we blame everything as far as weight gain on the fact that our estrogen levels are dropping. And some of that is absolutely true. But there's so many other factors that are involved in you not being able to lose weight. Estrogen is just a tiny one of them. There are multiple types of estrogens in the body. There are different types of estrogen that are more dominant during certain times in our life, like going through puberty and the form of estrogen that's produced during pregnancy, and what happens with estrogen once we go through menopause. Estrogen is actually made in our ovaries, in our adrenal glands, as well as fatty tissue. So it's important to understand that yes, estrogen imbalance can give you a certain body type, body shape, but it is not solely responsible for you not being able to lose weight. So the less you focus on that and more on some of the other areas, the better off you'll be, simply because you have to include multiple areas of imbalance in order for you to lose the weight. So, estrogen imbalance gives you a typical body shape like the first one. But let me caution you, because many of you have multiple different types of imbalances. These body shapes may merge. You may be a combination of the first, second, and third body shape all in one. Okay. So remember that. But the typical female dominant, estrogen dominant body shape that is imbalanced looks like this, because the weight gain is generally more from the waist down. The weight gain is generally more from the waist down. That's why you see a larger pelvic area with the hips and the thighs, and the more pear shaped, correct, body shape. So, but that is a sign that there is an estrogen imbalance as well, and that there may be some effect on that with your the inability to lose weight, but it is such only one of multiple. So it's just something to keep in mind. And ladies, if you're not menopausal age and you look like this anyway, then yeah, this is not necessarily the answer for you in terms of trying to figure out why you can't lose weight. So I'm not poo-pooing the idea that estrogen affects the inability to lose weight. I just want you to put it in perspective so that you understand it's just a tiny piece of the puzzle. So let's look at the second body shape. This is so important, so very important. In fact, it's probably on my list. It's one of the top two because, and estrogen being probably the third, simply because adrenal. Now, most of my ladies that see me are in their 40s, 50s, 60s, even 80s. And this is the body shape that they see. This is the pooch in the middle. This is the belly fat. The title of some of my webinars is Hormone Imbalance, Inflammation, and Belly Fat, right? Because many times you're looking at this picture, or you look in the mirror and that's the picture that you see. You see this belly fat, you see this pooch sticking out, and it's mainly weight gain that's in the middle. And most of us that are complaining about weight gain as we get older, this is the picture that we usually see. It has to do with a cortisol imbalance that is causing you to have adrenal fatigue. So this second picture is a very common depiction of a lady that has adrenal fatigue. Now, what happens when a person has adrenal fatigue? First off, or adrenal insufficiency. First off, they usually also have not just weight gain and belly fat, that's mainly the belly fat that they notice more than anything else, but they also have brain fog, fatigue, sleep issues. They may have lots of hot flashes and they think it's all menopause, right? Because every hot flash has to do with ovaries and low estrogen, and that's not true. Because the adrenal glands make a small amount of estrogen, that when you have adrenal fatigue or adrenal insufficiency, you may get hot flashes. So the treatment for the hot flashes is not just focusing on the ovaries, you have to also address the adrenal glands. And that's why some of you have gone through hormone replacement and you say, oh, it really didn't help me very much. Well, I'm not surprised. I'm not surprised because the area that needed also to be tended to was not. So let's get back to the weight gain, because this picture with the lady with the pooch in the middle, and it's usually a pretty soft belly, usually. But the reason that belly fat has occurred is because this lady has an overproduction of cortisol. Cortisol is your stress hormone. It's your fight or flight hormone. Cortisol is produced from the adrenal gland. And when your body is so overstressed, I mean, stress from emotional stress, stress from digestive issues, stress from pain, from joint pain, stress from staring at a computer screen from too many hours in a day. That stresses the retina, stresses the body. Stress comes in so many different forms, even foods that you're sensitive to. I'm not talking about allergies because that's a stressor too, but you can be not allergic to a food, but sensitive to a food, and you still have a stress reaction in your body. It's just that reaction is delayed and it's hard for you to connect it to the food that caused it. That's another conversation, right? Those are my food sensitivity lectures. So when we talk about your body being overstressed, an overabundance, our body is made to handle stress. We've got good stressors and we've got bad stressors. But when we have an overabundance of the bad stressors, it's too much cortisol production. And cortisol is your body's stress hormone. It is your body's stress hormone. Why am I saying that? Because when your body feels stressed, whether you're recognizing it or not, that's the key. You may not even know it. And when your body recognizes something stressful is happening inside, it produces or secretes cortisol. When it's constantly secreting it over and over and over, more than what it should, you will eventually have an overabundance of cortisol being secreted in your bloodstream. Cortisol is there to prepare your body for a stressful event. It's to prepare us for stress. It's to get us ready to battle the neighboring tribe, hunt for our food, whatever it is that is a stress on the body, whether it's physical, to go to battle, to run, to hunt, whatever it is. Hundreds and hundreds of years ago, when we needed to do that, cortisol was the reason our body got us ready for that. Well, guess what? When you're eating something that you're sensitive to and you don't even know it because it happens to be your favorite food, some potato chips or something you like to snack on, even popcorn. If you're sensitive to corn, your cortisol is going to be secreting. So it's going to be thinking it has to get you ready for some sort of stressful event. You don't need it then, right? Of course not. But your body's still doing it. And in the effort to get you ready for a stressful event, cortisol tells your body to produce sugar. Yes, why? Sugar's fuel. Sugar's energy. It's getting your muscles ready to run or fight the tribe or whatever that we did hundreds and hundreds and hundreds of years ago that we don't need to do now. It still happens. It is our fight or flight hormone. Fight or run, right? Fight or flight. And that process is still happening. And when our body produces sugar, glucose, because cortisol tells our body to make it, you don't even have to eat it. Same glucose that you're going to get if you ate a piece of cake. You're still producing sugar. Sugar's fuel, sugar's energy. Sugar goes into the muscles so you can have what you need for physical activity. What if you don't need that? And most of the time we don't. So now we're overproducing sugar. And as a result of that, we're overproducing insulin. And as a result of that, we become insulin resistant. And when you become insulin resistant, you gain weight. Many of you will crave sugar because being insulin resistant means that sugar is floating in your bloodstream and not being absorbed into the muscles and the tissue where it needs to go because it's too much, way too much. And the body rejects it and says, nope, no more. So now it's floating in your bloodstream and you go from insulin resistance to pre-diabetes to diabetes, type 2 diabetes, and you can't even figure out why because you have a good diet. It doesn't run in your family, or maybe it does. But you're like, how did I get that? Right? So now you're gaining weight because weight gain is a consequence of adrenal fatigue, low energy, brain fog, and there's a direct relationship between lowering the thyroid hormone levels and insulin resistance, all because the adrenal glands have been overworked. And when they become overworked because of way too much cortisol requirements, you pack it on in the middle, you get belly fat. And these are hormonal imbalance with the insulin, with the cortisol, and with the adrenal glands. That's why you can't lose the weight. You're working on the wrong thing. Talking about adrenal insufficiency or adrenal fatigue. And I just want to wrap that up by saying the adrenal glands are responsible for multiple hormones. In fact, they're two tiny little glands. One sits on top of each kidney. They're about the size of a bean or a pea. And all they do are produce hormones. They produce over 500 different hormones for the body. Isn't that something? So when those glands get tired or overworked because the amount of cortisol requirement is so demanding, the glands themselves just shut down. They just wear out and get tired. And you can imagine, if they're responsible for all those different hormones, how that affects your body in so many different ways. And you don't even know it, because it's not a typical test that we test for, right? So when you have adrenal fatigue or adrenal insufficiency, and you have that belly fat in the middle that it's very, very difficult to get rid of, you can exercise, you can work out, you can do all sorts of things, and you can't seem to get that off. The reason is because it's the hormonal imbalance that's not being addressed, not the fact that you haven't counted enough carbs or calories to address the problem. The other thing I want to mention about the adrenal glands is that, yes, they are responsible for making a small amount of estrogen. So when you do have adrenal fatigue, you can get night sweats and hot flashes. Yes, night sweats and hot flashes. And you assume it's something, menopausal, when it isn't necessarily menopausal at all, but you're getting those menopausal type symptoms. So for ladies that are getting hormone replacement and it's just not quite helping them, that may very well be the problem, because the area that needs to be looked at and addressed is not being addressed. Okay. And when I work with you, yes, we work to revitalize and restore and reboot and help to strengthen those adrenal glands again. Nothing on this slide cannot be improved upon. Okay. Nothing on this slide cannot be improved upon. You can help every area. They just need to be rebooted. And there's a very specific way, though, that you go about doing that. But it needs to be diagnosed first. And that's why I love functional medicine so much, because I am a traditional physician for years, but functional medicine has given me a method of helping people in ways that they don't teach us and haven't taught us in traditional medical school or in any of our ongoing training. So adrenal fatigue is a big deal. And for men, I have to say this, the adrenal glands are 100% responsible for producing the hormone that produces testosterone. The adrenal glands are 100% responsible for producing the hormone that produces testosterone. In other words, or a majority of the testosterone. In other words, the hormone DHEA is produced from the adrenal gland, and it produces testosterone. You must have DHEA in order to produce testosterone. And DHEA comes from the adrenal gland. So if a man is burnt out, tired, exhausted, worn out, overworked, and he has adrenal fatigue as well, because yes, men get that, we're all humans, right? He can have erectile dysfunction. He can have low testosterone, low T, and issues performing and be a young man. I'm taking care of men right now in their 30s and early 40s, and I am giving them support for their adrenal glands and their testosterone production, simply because it's low. And a lot of young men have low levels now, and they can't figure out why, because physiologically they should be fine. But there's so much stress out here now, emotional stress and everything, that it impacts men and women. So in other words, no matter what age you are, if you're noticing anything like that, and you're male as well in terms of sexual function, you must look into that. And again, really reach out to me, because this is an area that I tend to focus on too in functional medicine, because I see it so much. Okay. So again, um, hot flashes and things like that in women that mimic menopause, and erectile dysfunction or low testosterone in men that mimic men just getting older, and you're a young guy, you really have to look at your adrenal glands and see if there's adrenal fatigue, because that is a big, 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 big issue, more than what we realize. Okay. So let's move on to thyroid. Now, many, many times ladies come to me, and men come to me, and they think they have a normal thyroid. They're saying that they can't lose weight, or they're tired all the time, or brain fog, or constipation, or low libido, or all sorts of things. They can't figure it out because they've gone to their doctor, and their doctor either has tested them, but usually it's only the screening tests that are done. They're not thoroughly testing like I suggest they do. And so they're being told that their thyroid levels are normal, or they may be on thyroid medication, and the screening tests are done just to make sure the thyroid medication is so quote unquote adequate. And so they're thinking that everything is fine with their thyroid, but they're still feeling symptoms of an underactive thyroid. And that's the key. Even if your tests are normal, if you feel the symptoms of an underactive thyroid, and you've Googled it by now, you've looked it up, so you know probably as much as I do that it's low energy, brain fog, constipation, thinning hair, thin nails. It could be low libido. So it's so many different aspects, and your metabolism is slower, so you gain weight, and you just, that's usually the reason women ask to have it checked, though, is because of the weight. But anyway, if you are still having those symptoms despite being told your thyroid medicine is adequate, or that you don't even have a thyroid problem, please don't think it's all in your head. Dig further. Dig further, because even though you may be treated with the proper prescription medicine for that, or you've been told you don't even need it, it's very, very likely that's not true. Probably 50% of everyone that sees me and has been told that they have a normal thyroid level, it has hypothyroid. How does that happen? The screening tests only look at the thyroid level, the thyroid hormone that's produced from the gland itself, and the thyroid stimulating hormone that's a positive feedback loop that tells the body if it needs more. This right here, I'm going to show you a model. This is your trachea. Okay, this whole thing here. And this brown organ is your thyroid gland. Oh, I'm trying to get it in the camera here. This is the thyroid gland. It's a butterfly-shaped gland that sits right here in the neck. Okay, like that. That's the only test that's done. They test you to see if the amount of thyroid hormone that's produced directly from the gland is adequate. Many times it is, but I'm here to tell you the form that actually does the work, the form of thyroxine that actually does the work, is almost never tested for. And the form of thyroxine that does the work is a converted form of thyroxine. So you have the form that's made in the neck. 93% of that form of thyroxine is inactive. I want to say that again. 93% of the form of thyroxine made from the gland is inactive. It comes out just floating there in your bloodstream, doing nothing, waiting to be converted. 60% of the conversion of that thyroid hormone occurs in the gut and the liver. 60%. So if you've got digestive issues, constipation, anything else going on, burping, gas, foul-smelling stools, indigestion, GERD, on medication, Prilosec, whatever it is for your stomach, you don't have a healthy digestive tract. You are probably not making enough of the converted form. And the converted form of thyroxine is the one that does the work. Why we don't routinely test for it, I don't know. We are told to only get 2 of your tests. So the converted form literally is the one doing the work. It's the one controlling your metabolism. It's the one giving you energy, helping with brain fog, helping with weight loss, helping with constipation, helping with libido, helping with your menstrual cycle, ladies. It's the one doing the work. Every single organ in your body, from your brain, heart, lungs, kidneys, ovaries, uterus, whatever it is, every organ in the body has a receptor for thyroxine. That's how important that hormone is. That is probably the most important hormone in the body. It's thyroid, it's thyroxine. So when it's not being thoroughly tested for the form that does the work, you can be walking around hypothyroid or even hyper and not know it. You could be on medication and still having symptoms of a thyroid that's not right. And the doctor keeps telling you your tests are normal, your tests are fine, everything's good. And you walk out of there and say, but something's wrong. I still have this, and this. Something's not working right. And it's because it's very possible an underactive thyroid hormone level is missed because it's not being tested for. Doesn't this I hope I'm resonating here. It's very possible that 50% of you that are told your thyroid levels are fine, you actually have an underactive thyroid hormone level. It doesn't mean something's wrong with your thyroid gland. You're probably making enough, but you're not converting enough. Okay? And the thyroid hormone that's made here requires selenium and iodine. So you might be making enough for the range of normal range, right? But maybe you're on the low end of normal. And if you're on the low end of that normal range, your doctor will still tell you you're in the normal range, you're fine. But it's too low for you. The low end of normal may be too low for you because it's a standardized range, just a one size fit all. And that's not what you want. That's not what we're all about here. Okay. So I was wrapping up with thyroid because it's so important to understand that when you have an undiagnosed thyroid problem, you could actually have a low metabolism and just walking around and don't even realize that. And that's for men and women, right? So it's really important to insist on more thorough testing. You can always follow up with me because my approach is to deal with the reason. It could either be you're not making enough from the thyroid or you're not converting enough, and there the treatment or the approach to those are different. Okay, so and again, I can be reached at drchapman.com. That's www.drchapman.com or 248 569-8420. Okay. You can go right to my website and book a discovery call or a consultation with me. Either way, okay. I am definitely accessible. I'm in the state of Michigan. So those of you that can get to me, come in for a face-to-face. Otherwise, I can do a virtual appointment with you as well. So I want to say again about the thyroid before I wrap up because my time is a little limited now. Is that when you do have an underactive thyroid, typically the weight gain is everywhere. Okay. You gain weight in the middle, your legs, your shoulders, everywhere. Your legs. Sometimes you can even get edema or swelling in the front of your shins. Isn't that something? In the front of your shins as well as your ankles as well. So it's important to understand that an underactive thyroid does give you weight gain, principally all over the body, as opposed to adrenals. If it's only the adrenal fatigue, you get it in the middle. And if it's more of an estrogen imbalance, it's waist down. But guess what? How many of you only have one of those? It's usually a combination of things. So I just of imbalances. So most women I see have a little bit of everything that's on this sheet on this slide. So it's important to understand that you may be a mixture, but you can probably see yourself in these pictures somewhere. The last one we chose a gentleman to put to use because look at his belly. Most men think that that's just a beer belly, right? Well, I'm here to tell you that that's a sign of liver and issues, not necessarily liver disease or cirrhosis. Don't panic. But it is a sign that you probably need to detox. It's very important that we all detoxify and get the toxins out of our systems as much as possible. He also has insulin resistance, so he's going to have the belly like adrenal fatigue as well. This gentleman probably has some adrenal fatigue as well. So there's usually a combination of the insulin resistance and the liver meaning that it's so important to detox. Why is detoxing important? Well, of course, we know everyone needs to detoxify. You need to get the poisons out of your tissue as much as possible. Your liver and your kidneys are your detox organs, mainly the liver. It's responsible for mainly detoxing, but the kidneys flush it out as well. So anytime you're detoxing, you want to always drink a lot of water, at least 8 to 10 glasses. But please don't just grab a detox off the shelf, because that's not the best way to do it. It really needs to be supervised, because sometimes your needs for detoxing and the way you detox is dependent upon the health of your body. If you've got kidney problems, the detox needs to be tailored a different way. If you've got some other issues, it needs to be tailored a different way. So it's important to see someone who knows how to do that for you. But detoxing is very important. Why is even detoxing up here? Do you know that when your body accumulates toxins, and where are they coming from? Pesticides, preservatives on the food, skincare products, hair care products, cleaning products, the air, the water, food colors, food dyes. It's so many different places that we can get toxins, even work environments, especially if you're working in a place where the air is just really dirty. So those toxins accumulate in your body. Your kidney and liver gets rid of as much of it as it can, as much of it as it can. But there's always some of the poisons, and I'm going to call them poisons because that's what they really are, left behind. Why do you think people get cancer and different things because of exposure to certain products? Because they're poisons. But what they do is your body is so miraculous that it compartmentalizes those toxins away from the major organs, away from the brain, the heart, the lungs, the kidneys, the reproductive organs, as it compartmentalizes them away from those organs as much as it can. So when your body can't get rid of them from the natural detoxifying mechanisms that it has, it ends up having to store them some kind of way, and it wants to protect your major organs from them. So guess where it's stored? In your fatty tissue. Your body stores toxins in your fatty tissue. Here's my favorite 5 pound of fat that I'm showing you. This is where your body stores toxins, in the fatty tissue. Why? Because it keeps it away from the major organs. So when you're trying to lose weight, if you've got an accumulation of toxin in your fatty tissue, don't you think you're going to have a tug of war? Do you think your body's going to let you lose that fat where it's storing the poisons? No, you're going to have a hard time losing weight, because the body is all about survival and keeping you living. So if you're trying to lose weight and you've got an overabundance of toxins, you're going to have a hard time losing weight, because the body says, I need that fatty tissue. I need it to store these poisons. So it's important to detox as much as you can. No, I'm not saying you're going to rid your body of all the toxins. Be reasonable. That's not going to happen. But we want to reduce it as much as possible, because not only is it healthy for you overall, it's also helpful and helps you lose those fat pounds as well. Does this make sense? So when I talk about why you can't lose weight, I spend an entire hour going over the hormonal imbalances, the most common ones. Of course, I haven't talked about everything. I don't have time in an hour for that. But the most common ones that cause you to have a hard time losing weight. I hope this was very helpful for you. I'm all about education and teaching and helping you understand what needs to be done to help your body get those pounds off and keep them off. That's the key. You want to get those pounds off and you want to keep them off, because if you don't do what you need to address the various hormonal imbalances in your body that's causing you to keep those pounds, you're going to be in a box struggling to lose your weight for the rest of your life. And it's so frustrating. It's very depressing. You don't want to look in the mirror. You don't feel sexy anymore. So come on, ladies. Come on. Even men. You want to get yourself as healthy as possible. Stop looking at counting carbs and calories. I do not have any of my patients count carbs and calories, portion control, or even push away from the table. It's not necessary, because when we deal with the issues that you're looking at on the screen, your body will naturally lose those pounds and you'll learn how to keep them off. Okay. So this is Dr. Silmarra Chapman. It has been my pleasure. It seems like the hour just flew by this time.